Welcome back to Creating Cooperative Kids. I'm your host, Bill Corbett. The acronym ADHD stands for Attention Deficit Hyperactivity Disorder, and adults who work or live with children with this disorder are tasked with creating focus to manage their attention. Now, the Centers for Disease Control lists several treatment options, and one near the top of that list isn't medication. It's actually parent education. Today, I've invited Dr. Megan Hudson of the Brain Balance Center of West Springfield, Massachusetts, to come on the show and help us understand two important things that's going on in the brain of a child with ADHD and what parents can do to create more focus to manage the child's attention. Welcome to the show, Dr. Hudson.
Thank you. Thanks for having me.
So quickly, if you could tell our viewers, what is a Brain Balance Center?
Brain Balance Achievement Centers are designed to help change the brain function of children who have a wide range of learning and behavioral disorders. We work to address the weaker side or the less mature side of the brain hemispheres to stimulate them appropriately to develop more so that then learning and behavior and different types of conditions can then be remediated.
Okay, so this might be a silly question, but there's obviously disadvantages that these children have to children whose brains who are not like that.
Yes, what we found is that a lot of, we're speaking specifically about ADHD, but we also work with a lot of different other issues. But focusing on ADHD, we found that the children who have been labeled with this condition usually have demonstrating a weaker right brain. So we do assessments and testing to see if that's actually true in the child, and then if we find that to be correct, then the exercises and the activities that we do are designed to stimulate that weaker function. So kids who are more typical, who are not struggling in the same ways, their hemispheres are working together in a better fashion.
All right, so I've just got to ask you, I'm just curious, how do you stimulate a region of the brain? I'm just guessing, are you using video clips? Are you using shock therapy? Are you using, I'm kidding, I'm kidding. Are you using reading assignments? I'm thinking maybe that you give them assignments to act out?
Actually, what we do is very structured. It's protocol driven. Kids come in 3 times a week for 12 weeks, and they spend half an hour in the sensory motor room where they do all kinds of activities, including sensory exercises, balancing on one foot, walking on a balance beam. We do work with visual exercises to get their eyes moving more efficiently. We use sense of smell. We do all kinds of things in that room that are very sensory, motor, more physical based. And then they spend half an hour in the cognitive room where they get to do activities from more of an academic point of view that are specifically designed to stimulate one region of the brain versus the other region.
Okay, so are there centers all over the U.S. then I
There are.
Okay, so I've asked my crew to make sure that we run your website at the bottom of the screen where parents can go to get more information who are in need of help. So the thing that I want to ask you is parents are confronted with the issue of managing their ADHD child's focus when they're at home. What kind of things can parents do that you would suggest with your expertise, things that parents can do right away as simple as possible?
Well, I do want to mention a very helpful book that is written by the co-founder of the Brain Balance Achievement Center. And this program is actually the home-based program for parents. So this is a great resource to be able to help figure out if there are activities that they can do. But I would recommend that what they do is really get to understand more deeply what it is that their children are struggling with in terms of, are they oversensitive to light? Are they oversensitive to sound? Do they have a difficulty processing touch or being touched? There's so much information that you can actually learn about what's going on in a child's brain by just observation. So one of the best things is to figure out a little bit more with your children what sets them off. So if there's a problem doing homework, you really want to make sure that they're in a place in the house that there's not a lot of distraction. There's no TV they can hear. Maybe they should be wearing headphones. And a lot of times it's very helpful, maybe not convenient, to have somebody actually physically sitting with them, not necessarily engaged in their activity, but as you mentioned, just that touch, even just sitting and having your knee touching the child's knee while they're trying to focus can really help to ground.
Now, interesting. The question I want to ask is, do you deal with children who are medicated or unmedicated, or does it matter?
Oh, that's a great question. When we do an assessment of a child to see how they're doing, and we spend 3 days doing an assessment of their sensory motor and then their cognitive function. We just need to know if they're on medication. We really want to see what they're capable of doing. So some kids really have a hard time doing anything without having certain types of medication in their system. it's really up to the parents to decide whether they're going to take them off that day or not. And then when they're in the program, we want them to sort of do what they've normally been doing. I think the goal for most people is to not have their kids need the medications, but we're not prescribing or telling people to take their children off meds. We're not coming from a medical point of view. So that's a conversation that needs to happen between the parents and the doctors that they're working with.
What about the environment at home? Are there things that parents can do in the environment to change the child's focus and to be more successful?
Well, one thing that's maybe people don't realize is how much sometimes children are really affected by bright lights. I think in a lot of kids go to school all day and the lights are very bright. There are a lot of fluorescent lights. There can be a real visual overstimulation from that. And so a lot of times kids really need time to just decompress. Turn the lights down, turn the lights off, give them a chance to just get off of being in the bright light. And then look at the lighting in the home. So if you have a lot of fluorescent lights in your kitchen or something, that can really amp up behavior. So that's one of the quick things you can do is really look at your lighting.
Okay. Is it all lighting or primarily fluorescent lighting?
Especially the fluorescent. We live in a blue world, and the color blue is actually very stimulating to the right brain. So that's actually more like the brake pedal. And
so what is it? What happens? Can you just tell us what happens when if there's bright fluorescent lights? What's going on with the child?
Well, the fluorescent lights are lacking in their ability to duplicate the full spectrum of light, which is what we get from natural sunlight. Human beings are able to perceive the visual spectrum. And so fluorescent lights are actually taking out some of both ends, but especially the higher frequencies. They're taking them out. And they're also, some of the older ones especially, but they flicker. You can tell, especially old school buildings with old lights, there's this flickering that happens. It's very disturbing to visual cortex and to processing speeds.
What, in layman terms, what's happening with the brain at that point?
At that point, it's just disrupting. I mean, when you think about what are humans designed to be in is natural light. And so if you have a lot of unnatural light, then it's very hard to see. It's hard to concentrate. It's very fatiguing. I mean, anybody who's worked in an office with lights that are like that, you kind of know. If you spend too much time on the computer, you kind of get a brain fatigue because you're not getting enough natural light in. So this is very important for kids.
We just got another quick minute. Anything else that you can offer to parents for a quick success?
Well, another thing would be to really think about all the senses. So looking at the sense of smell, are there a lot of people don't like smells, so they fill their home with lots of chemicals and fragrances and sprays.
So minimize that if you have a child with ADHD.
Absolutely, minimize that. And notice if you use it, notice if there's a behavioral effect on your child.
Would a child know? Can I ask my child, hey, does the new air spray that we're using bothering you? Would they know?
Some kids know.
They would?
Every kid's unique, just like adults, and some kids maybe don't have a very strongly developed sense of smell yet, so they may not be aware of it, but some kids know. Absolutely.
Interesting.
Ask them.
Okay, I'm going to do that. That's great. Well, this is very valuable information. I appreciate you being here and sharing that information with us because it's such a mystery, the whole disorder, and it's got a lot of parents frustrated and teachers as well. So, excellent. Now, what if I were to tell you that some foods can have negative effects on the brain in some individuals? I just learned this from Dr. Hudson. I recently became aware of the issue of some children being actually hypersensitive to foods and the effects it might have on their behavior. I've asked Dr. Hudson to stay on after the break to shed some light on this whole topic. Don't go away. We'll be right back.